Hi, I'm Ian Vasquez-Idanen. Today we'll be talking about infection control, sharp awareness. Right. One key thing to know about sharp awareness is that it protects you against bloodborne pathogens. So to prevent that, you want to make sure that your trays are nice and neat. You want to know where your instruments are, so whenever you set up for procedures for a provider with any procedures, you want to make sure you know where everything is at all times. You also want to establish a sharp zone. A sharp zone basically entails that you're designating an area where you place your needles, your sutures, your surgical blades, mesis basins during surgeries, so that when you're done with the procedure, you know where everything is at and you can dispose of it immediately. Safety with sharps. You always want to use common sense. You want to be cautious when you're handling your anesthetic syringes. And a method that you must know how to use is the one-handed scoop technique. And there's a diagram here that basically displays that. One key rule whenever you're handling sharps is that a provider will be the only provider or the only person that's responsible for capping and recapping a syringe. So any dental procedures, if there's a needle that needs to be recapped, the provider has to cap it for you. Now, the assistant will not accept any uncapped needle. If you see an uncapped needle, you tell the provider, let them know that it's uncapped and they'll cap it for you. A technician will assemble the syringe, and here it shows two different ways that you could do it. You want to utilize a hemostat whenever you cap a needle and also uncap a needle. You want to make sure that the needle cap remains seated firmly on its hub, and upon removal of the needle from the syringe, always use the hemostat. That's a key thing. But another thing that we use is burrs. Burrs can be a likely culprit for a sharp stick. So you want to make sure that you always have the safety top covered or closed. When you're removing or replacing a burr from a burr block, you want to utilize a cotton forceps. Never use your fingers. So that's a very likely chance that you can get poked from a burr. And also, whenever you clean up your procedure, during a procedure, you want to remove any burrs from a handpiece, because that's also could be a possible incident. Right, and here's a picture of a handpiece with a burr. Now it's asking you guys what's wrong with the setup, and obviously the handpiece still has the burr in it. So the provider can either take that off for you and remove it so that it's a lot easier for cleanup, and also it prevents that burr from sticking you when you're cleaning up. And there's always like close calls whenever we have dental procedures. So you want to make sure that these things are prevented at all times. So definitely always have a nice, organized, neat setup, and never have your burr blocks open. And that's basically it. And one key advice is to always work smart and be as safe as possible. All right, thank you. All right, do you guys have any questions?
I have a question. So what do we do if we accidentally stick ourselves? Where do we go? What do we do?
Okay. So when you stick yourself, you want to make sure that you rinse yourself off. Make sure you cleanse yourself as clean as possible with antiseptics, any antibacterials, and then you want to notify not just the provider, also the supervisor in charge of that department. From there, you'll basically tell the patient to stay behind just in case there's any bloodborne pathogens that might have been transmitted. And then from there, you have to get blood work, you have to do reports and things like that. So you want to make sure that you basically follow through with that. definitely contact the hospital as well. So those are just key protocols when it comes to that event from happening.
And is this information online, or where do I get the information? Like, where do I go?
So you can get it from there's manuals or SOPs, standard operating procedures, in an event that a sharp does happen. So things like that, we have a procedure and protocols for that. So
Right, thank you.
Do both the patients and the assistant have to go to the hospital together?
yes, so in the event that there was a sharp stick or sharp incident, then yes, both the technician as well as the patient has to go together to get blood work done. And there's a series of blood work just to make sure that nothing was transmitted. Yeah. That's it.